A director of the Yorkshire Ambulance Service has been disciplined after criticising the NHS on Facebook. David Forster posted a comment saying the NHS employed too many who are lazy, unproductive, obstinate, militant and aggressive at every turn. But his comments really apply to the public sector. And Len Shackleton is an Institute of Economics Affairs Fellow, which means he's a manager in the public sector. And Mike Travis is a staff nurse in Liverpool and is shop steward for the Royal College of Nursing Union. Len, first of all, what's your reaction to these comments?
Well, he sort of let the cat out of the bag here, didn't he? I noticed the trusts say we hold our dedicated and professional staff in extremely high regard and work alongside them in partnership with our trade unions. And I think that's, you know, a large part of the issue here. It's very, very difficult to dismiss people in the public sector. And he may well have exposed something which is more widely applicable than in the ambulance service in Yorkshire.
So you agree with him?
I believe he's got a point. Productivity is low in the public sector. It actually fell for a decade up until a couple of years ago. We know from a recent KPMG report that you could have had the same quality and quantity of public sector services for £60 billion less if productivity had kept up with the private sector during that period.
Mike, you must want to say something at this point. Productivity is down, lazy, unproductive public sector.
Yes, I do actually, and I can say in the past 18 months in my hospital in Liverpool, when there was an upsurge, when there was an opportunity to take in more work into the hospital because of the type of work that we did, the workforce in that hospital took on and raised its productivity within that area by about 14%. And I keep hearing people talk about this work productivity, when really, as someone who delivers care and looks after some of the poorest people in society, what they should be looking at is outcomes. And you're all right. I mean, you know, we don't make a car, and we don't have so many cars a year rolling off the production line. But in healthcare, what we do is we fix society and we keep society together. And what a lot of people do, you know, and it could be anything from hip operations and getting them active again and back into the workforce, to unfortunately, you know, where you have a death, and a good death is as important as good care.
But why does that mean that you can't have targets on productivity, on work rate, on waiting lists being whittled down? Why are you exempt from all the targets that everyone else has to meet?
Well, again, I'd say within my organisation, if you looked at the 18-week waiting list, we're way down below 18 weeks for how we put our patients through the system, and that's because clinicians, doctors and nurses and managers and trade unions to sort of help to redesign services have done a lot of hard work to make those systems work and to improve them, and they're always improving them.
Len.
And the trouble is that you don't hear about the good stories. You only hear about these political issues of productivity. But again, trying to get down to the point is, what do they actually mean by productivity, and how do you compare it to a car firm or to...
OK, so Len, what do you make of that? What do you mean by productivity?
Well, actually, the Office for National Statistics has just recently published a new report which uses a new indicator for productivity, and that's what these kind of figures are based on. Attempts to measure the quality of output rather than simply the quantity of it. It's not simply, sort of head counting or bed counting or something like that. You've got to build into that some notion of the quality of service. And, you know, it's not necessarily attacking public sector workers as a whole. I mean, very, very many people in the public sector do a terrific job, but the public sector as a whole has not been well managed for the last decade or so. Money was thrown at it by the last government, and Gordon Brown really prevented the kind of reforms in the organisation of the public sector which Tony Blair was seeking.
Here's the thing, Mike. Obviously, there are some excellent people that work for the NHS and work in the public sector. But isn't it all too easy for someone who is lazy to hide in this giant machine? And it's very difficult to get them out of their job because of unions like yours, perhaps.
No, I think one of the important things to remember is that everybody that is in work, and in a democratic a country like the UK has a right to representation in work. And there will be members of staff who, through age, through disability, or just through personal circumstances, are not particularly working at their optimum at a particular time in their lives. And the idea about having a workforce planning is to make sure that you retain those skills. And so we help people through a whole range of things, from personal debts within families to debts to marriage breakups. But the important thing is about the NHS these days is that you can't be lazy in it. If you look at the way our nurses work on the wards, our nurses and our healthcare assistants and our physios and our
But there's
doctors,
a hell of a lot of middle managers still, aren't there? And all the bureaucracy that exists still in the NHS. Not every employee on a public sector pay packet and pension is a nurse or a doctor.
Well, if you look at recent international comparisons of the NHS with other World Health Organisations like the US and Canada and Australia, they pinpoint that, in fact, the NHS is very economic in terms of its management costs.
It has been a decline in the quality of delivery of public health. It's been a reduction in the kind of public-spirited ethos. A preoccupation with things imported from the private sector.
Len Shackleton, what do you want to say on that then? It's
Well, I don't see that market principles have really been applied to the National Health Service. There have been a few half-hearted attempts to do this. But I mean, one example of this is and I go back to union influence on this. We have national bargaining for all of the NHS. And so apart from a fairly minuscule London allowance, essentially people are paid the same in an area like the North East, where jobs are scarce, as they are in London. And this has led to a decline in the quality of service in big cities like London. Very interesting piece of research by the Centre for Economic Performance at the London School of Economics came out recently, which suggested that actually the quality of service, as reflected by death rates in accidents and emergencies, was actually lower in London than the North East, and this was associated with the poor quality of staff that they were recruiting and their reliance on agency workers and so forth.
Mike?
Yeah, I mean, it's really interesting that Len brings in the issue about national bargaining, but I think one of the important things to remember, there's a body of research out there which shows that if you started to negotiate pay regionally or even down to individual hospitals like foundation trusts, then your costs would go up hugely, because there isn't the expertise in order to negotiate and influence pay in such a big organisation of 1 million people. That's treating 1 million patients every 36 hours. And when we talk about London is a very different economy from the rest of the country. And if you go into the North East, the problem with the North East will be that if the health outcomes there are bad, it's because there's lots more smaller hospitals doing less work. And again, research shows that the bigger the bigger the cardiac service, the bigger the A&E, the bigger the maternity unit, the better outcomes there are. But the public are going to have to accept that if they want an increase in quality, then they most probably have to lose their local cottage hospitals to make that happen.
When you get a member of staff who is underperforming, let's say, getting rid of them is incredibly difficult, is it not, in something like the public sector?
My experience is that there are in the majority of hospitals things that are called capability policies, which bring up and which identify poor practice or poor employment practice within an area. And if there is a shortcoming, whether they're a senior manager or they're down to a nurse or a porter, then they will be actively managed and helped to improve. But at the end of the day, if they can't improve, they will go. And so there are processes there that dampen down the hire and fire culture of, say, the private sector. But there are lots of people who can lose their jobs if they are not performing well.
Len, would you go along with that as a final word?
Well, I don't have Mike's detailed experience of the health service, but other parts of the public sector, it's extraordinarily difficult to get rid of people. I mean, there's a panorama programme which BBC put out recently which showed that only 20 teachers have been dismissed for incompetence in 40 years. Now, that beggars belief that there weren't more incompetent teachers than that.
All right, Mike Travis, Len Shackleton, thank you for your time tonight on 5 Live. It's 11:33.